Good evening and thanks for joining us. I'm Patrice Dayton. There is progress being made to vaccinate people in both Indiana and Illinois. We'll have updates from both states in just a moment. But first, we want to update you on where our Indiana counties stand. Park County remains in the red this week. They are now joined by Vermilion and Clay. Vigo County remains in the orange. As we've explained before, each color is based on cases and positivity rates. Red is the worst ranking, followed by orange. Health officials want Hoosiers to remain alert. News 10's Dominic Miranda joins us now in our newsroom. He has an update with where Indiana stands on its vaccine efforts.
Patrice, Indiana State Health Commissioner Dr. Christina Box and Chief Medical Officer Dr. Lindsay Weaver say there's reason for hope here in the Hoosier State. Thousands of Hoosiers have already received their first dose of the vaccine. Here's how it all breaks down in Indiana. Dr. Weaver says as of data pulled on Tuesday, nearly 76,000 Hoosiers have already received their first dose of the vaccine. More than 110,000 Hoosiers in total have scheduled appointments for the vaccine through next Monday, and those numbers continue to grow. Those numbers do not include the nearly 40,000 doses that are set aside for long-term care facility residents and staff. It was also announced that a vaccine dashboard will be launched that will show the number of vaccines administered. That will be on the state's vaccine website and will be updated each Wednesday.
By the end of this week, Indiana will have been allocated 146,250 doses of Pfizer vaccine and 152,500 doses of Moderna vaccine. That represents nearly 250,000 healthcare Hoosiers who can receive their first doses of vaccine to protect them from COVID-19.
Dr. Weaver says weekly allocations of the vaccine will be lower going forward. This includes lower vaccinations occurring over Christmas and again for the new year. But officials say vaccines will be picking up once we get past the holidays.
We continue to focus our vaccination efforts on our frontline health workers because they are at the greatest risk of exposure. And as I mentioned, CVS and Walgreens have started their vaccination efforts in long-term care facilities this week.
Now, Dr. Weaver stressed that the state is moving in a very intentional order of vaccine distribution. This is to ensure that they don't run out of vaccines before opening up the vaccine to additional groups. She says to date, no vaccine has been wasted or has expired. Reporting live in the newsroom, I'm Dominic Miranda, News 10.